Esteemed colleagues and friends, delegates of the 6th World Sepsis Congress, on behalf of the Global Sepsis Alliance and our 6 regional sepsis alliances across Africa, Asia-Pacific, Europe, Eastern Mediterranean, Caribbean, and the Latin American Institute of Sepsis, we welcome you to our 6th edition of the World Sepsis Congress, and we thank you for your continuous engagement and support. This year, the Scientific Committee of the World Sepsis Congress decided to focus the theme of our discussions on universal sepsis care for newborns, children, and women. Because indeed, without prioritizing sepsis prevention, early detection, and treatment among children and women, we would not be able to attain Sustainable Development Goals and other global health commitments, including pandemic prevention and response, as well as antimicrobial resistance. We are delighted to welcome more than 6,800 officially registered participants to the current Congress, and over the 2 years we look forward to our other colleagues, healthcare providers, sepsis advocates, policymakers, and researchers to join the various scientific sessions of the Congress. We also use the opportunity to brief you on some of the important developments on the front of sepsis advocacy and our ongoing expanding partnership and alliance buildings for the sepsis advocacy. Last month in Brussels, the Global Sepsis Alliance and the European Sepsis Alliance were delighted to learn that the European Commission has allocated a historic 244 million euro as a research accelerator for new therapeutics against infectious diseases, AIDS, and sepsis. And we use the opportunity to thank the leadership of HERA and the European Commission for this extremely important opportunity. We're delighted that today's Congress is also supported by the Gates Foundation. And in addition to the financial support, more importantly, support from the Gates Foundation as the leader in the global health partnerships and the public-private partnership initiative support, including Gavi, Global Fund, and other major initiatives. We especially appreciate their priority and support to the neonatal sepsis prevention and management. And lastly, we're delighted to note that this year we have been part of another historic partnership initiative supported by the Laerdal Foundation. Global Sepsis Alliance, the World Health Organization, and the Society of Critical Care Medicine will be starting a new joint project that will position sepsis higher in the global health architecture, in the national agendas of the member states, and we will be developing both the first global report on health system response to sepsis, as well as the first multi-year global research strategy on sepsis. We thank every partner, every expert and member of the GSA community for their invaluable support, and we look forward to continuing our joint fight and putting sepsis to the high-level political agenda, both globally, regionally, and nationally, where it deserves to be. Because we cannot continue in the world where every 5 lives is lost to sepsis, and we don't see sepsis as the front page of the global health and development discussions. Without further ado, I would like to invite to the opening session of our Congress our first speaker, our dear friend and advocate for sepsis from Switzerland, Jennifer Epifanio. Jennifer Epifanio and her husband Daniel and their family, 3 years ago, in March 2023, lost an amazing 40-year-old Elia Epifanio. And since then, the family, after this unimaginable pain, turned their tragedy into the fight to save thousands of other lives. Jennifer, thank you very much for being with us, and your attendance, you and your family are the example of, unfortunately, 3 million children that we lose every year and 11 million people whose lives are claimed by sepsis, this devastating medical emergency every year. Jennifer, over to you. Thank you.
Thank you, Mariam. Good afternoon, ladies and gentlemen, here from Switzerland. My name is Jennifer Epifanio. I'm married and the mother of 3 sons. And honestly, I never imagined that one day I would be standing here at the World Sepsis Congress speaking about my eldest son. If I had ever thought I would speak about him in front of an audience like this, I would have imagined it would be about his career in motorsport, about his talent, his passion, and his future. But sadly, life took a very different path. Today, I'm here to share the story of our eldest son, Elia, whom we lost to sepsis in 2023 at the age of 14. I share his story because I want to help prevent other families from experiencing the same devastating loss that we did. Elia was healthy, athletic, and full of energy. He was one of the greatest young karting talents in Switzerland and had his whole life ahead of him. He returned from a school ski camp on a first day. The next day, I took him to Italy to train for the upcoming championship. That day, he only had a slight cough. By Saturday, he showed mild cold symptoms, but still wanted to visit the newly opened karting track on this day. I remember how excited he was, but sadly, he never got to drive there. On Sunday, we celebrated his 14th birthday with the family. Looking at the photos from that day, no one would ever imagine that less than 24 hours later, our son would be fighting for his life. That night, Elia developed a high fever, severe cough, breathing difficulties, and intense pain. It became so bad that he lay crying on the floor, begging me to take him to a doctor. Since no appointments were available, he insisted that I take him to the hospital. By the time we arrived, his condition was so severe that he could no longer walk or speak on his own. I had to take him to the pediatric ward in a wheelchair. After 4 hours, the senior physician told me that my son had influenza B and that we should go home and only return if the things got worse. In front of the doctors, I placed my very sick son back into the wheelchair and I pushed him out of the room, knowing how much pain he was in and how much he was struggling to breathe. That same evening, Elia suddenly began coughing up blood, and an ambulance rushed him back to the same hospital as before. Everything escalated very quickly. He was transferred to the emergency shock room. He was still conscious and asked us, "When can I finally go home?" And my husband asked him, "Are you afraid?" And our son answered, "Yes, Dad, I'm afraid." These were his last words in his life. Elia was then transferred to the University Children's Hospital in Zurich. He had to be resuscitated multiple times. We still did not know what was wrong with our child. Then, for the first time, we heard the word sepsis. Until that moment, we had never even heard of it. Doctors explained that his condition was very critical and that he could only survive with an ECMO machine. When I saw my son intubated, connected to many lines, with dark patches on his skin, I realized that nothing would ever be the same again. The next day, we were told that Elia was the sickest child in Switzerland. Just days earlier, he had been training for a championship. All we could do was hope. Doctors even considered amputating his legs, but his condition did not improve. On March 31st, 2023, the very day he was supposed to race for the championship, our son died of septic shock. Before losing Elia, we had never heard of sepsis. That is why we founded the Trofeo Elia Epifanio charity card race, to keep his memory alive, to raise awareness, and to support the University Children's Hospital in Zurich. I am here today because it is so important that we talk more about sepsis. Not only in hospitals, but in families, among friends, and in everyday life. Because awareness saves lives. In Elia's case, the warning signs were abnormal breathing, mottled skin, and extreme weakness. These are signs people need to recognize. I share our son's story because no family should have to go through this. Sepsis can affect anyone, and it can progress faster than we think. If even one life can be saved through greater awareness, then Elia's story has made a difference. Thank you for your attendance.
Jennifer, thank you so much. We can truly express how grateful we are for you and your whole family for not only turning your pain into, the war and becoming the true warriors for others, but for being with us for some of the main events around the World Sepsis Day in Geneva or today's World Sepsis Congress to really reach out to thousands of our stakeholders and the audiences and to really help prevent these tragedies in other thousands of other families. I had the pleasure last year to join you at Trofeo Elia Epifanio's event in Switzerland, and it was truly the most impressive initiative, bringing together the whole community of car racing and some of the most important players, both in sports and the healthcare sector of Switzerland, including the Zurich's Children's Hospital. So thank you very much for all what you are doing. And we really hope that both Trofeo Elia Epifanio, your initiative, and Elia's name will be much more visible and known to the sepsis communities across the world, because as you said, no other family has to go through this tragedy. Jennifer, allow me to also acknowledge among, unfortunately, thousands of other families, 4 families who are also part of our daily fight against sepsis. Carl Flatley, who lost his daughter, 23-year-old Erin Flatley, and who established the US-based Sepsis Alliance and was one of the co-founders of the Global Sepsis Alliance. Rory Staunton's 12-year-old Rory's parents, Kieran and Orlane, who became the key drivers of the quality of sepsis care in New York State and now has succeeded to advocate in the historic allocations from the US government to the federal sepsis programs. And they are also now working on the Sepsis Act in the US Senate. Duncan Brown, the father of 18-year-old Quan Brown from Australia, who has joined us as the co-chair of the Global Sepsis Survivor and Family Committee. And of course, Martha Miller's mother, who has become the driving force of the new legislation, Martha's Rule in UK, that has already saved more than 400 lives in the United Kingdom. These are the families, these are the examples of the parents who have saved thousands of others' lives and who continue to advocate for better awareness and stronger sepsis response at the global level. Jennifer, thank you again very much. And building on your message, I would like to now ask to present the video address of Dr. Tedros Ghebreyesus, Director General of the World Health Organization, who has been our strong supporter for years, both for the World Sepsis Congresses and the World Sepsis Days. And we have the video address from Dr. Tedros for the World Sepsis Day, where he once again reiterates his support to this global threat and medical emergency. Thank you.
Dr. Mariam Jashi, Dr. Tex Kissoon, dear colleagues and friends, there are almost 50 million cases of sepsis globally every year, half of which occur in babies and children, primarily in healthcare facilities. Most of the 11 million deaths caused by sepsis every year are preventable through low-cost infection prevention and control measures, early diagnosis, and rapid treatment. WHO is working with countries and communities to strengthen health systems to reduce the impact of sepsis. We have guidelines on reducing bloodstream infections, and we will soon publish guidelines on the prevention and clinical management of sepsis. We're also studying research priorities for maternal sepsis and how to reduce antimicrobial resistance, which undermines our most powerful tools to combat sepsis. Through WHO's Acute Care Action Network, we're working with 80 partner organizations to implement tools shown to dramatically reduce the deadly impact of sepsis. I thank the Global Sepsis Alliance for your leadership and partnership, and all of you for your commitment to preventing and treating sepsis, because nobody should die while seeking care. I thank you.
We are grateful to Dr. Tedros for his continued support to the Global Sepsis Alliance efforts and to the possibilities of raising the issue of sepsis as part of the WHO Executive Board and the World Health Assembly events. I hereby use the opportunity to announce that on May 21, the Global Sepsis Alliance, in partnership with the Medical Women's International Association and other key stakeholders, will be convening the second official World Health Assembly side event, How We Can Protect 26 million women and 20 million children for sepsis. All member state delegations, non-state actors, or international organizations are warmly welcomed to join our side event that will be held in the UN Palace in Geneva. Due to unexpected, extraordinary circumstances, Minister Sarjveladze, the Minister of IDPs, Health, Labor and Social Affairs of Georgia, unfortunately cannot join us in person, but his cabinet will be soon sharing video address from Minister Sarjveladze that we will be publishing on the official site of the World Sepsis Congress as well as the Global Sepsis Alliance. I have the pleasure now to present to you the special video address from Dorothee Bär, the Federal Minister of Research, Technology and Space of Germany. Dorothee brings impressive professional path, being the regional branch chair of the German Association of Christian Democratic Students and being one of the youngest elected members of German Bundestag. She has held parliamentary state secretary position to the Federal Minister of Transport and Digital Infrastructure, and also served as the Minister of State at the Federal Chancellery and Federal Commissioner for Digitalization. It is extremely important to note that the Ministry of Research of Germany has been supporting one of the most important multinational research projects for sepsis, STARS, and we highly appreciate the support of the ministry and personally Dorothee Bär. Please.
Dear Professor Reinhart, to all of you at the World Sepsis Congress, I appreciate any and all dedicated action for more health. But when I saw what the topic of your agenda is, I was truly moved. Your Congress is devoted to the especially vulnerable among us, newborns and children, the women and mothers, and I'm very grateful to you for this. I have 3 children myself, and to imagine that a mother loses her newborn to sepsis strikes me at my very core. Especially since we know death quite often could have been prevented. The knowledge is on hand, and so are the drugs. Only maybe not where mother and child happen to be, and this is exactly what needs to change. That's why our research ministry provides funding for sepsis research and has done so for many years. We've got programs on infection control, on fighting sepsis in newborns, and we are seeing to it that results end up where they are needed, in delivery rooms, in neonatal wards, in emergency rooms, also in more remote areas. So the motto is early detection, quick action, and a proper care everywhere around the world. That's why we are investing in international partnerships, first and foremost in the German-African STARS network. The goal is clear. More research on site, more training of skilled labor, and, of course, a better infrastructure. Especially because we know there's another danger out there. Antibiotics resistance. When these drugs are no longer effective, sepsis becomes even more dangerous. All this must be taken into account. Because ever since the COVID-19 pandemic, we've known our societies are vulnerable. But we also know what helps. Cooperation in science and research. To you, Professor Reinhart, a huge thank you for your steadfast efforts to advance STARS. My thanks also go to the Global Sepsis Alliance for your tireless dedication, which saves lives day after day. So please keep it up. And on this note, I wish you a good Congress. So many greetings here from me, from Berlin, yours, Dorothee Bär.
Thank you, Minister Bär. Your support is extremely valuable to the Global Sepsis Alliance. And of course, we all join your special appreciation of Professor Konrad Reinhart, the founding president of the GSA, who has been behind most of the changes, not only in Germany, but globally. Now I have the pleasure of handing over to Professor Niranjan Tex Kissoon, President of the Global Sepsis Alliance, co-chair of the World Sepsis Congress, and past president of the World Federation of Pediatric Critical Intensive Care Societies. Tex, please, over to you.
Thank you very much, Mariam, and colleagues and friends across the world. Good morning, good evening, good night, wherever you are. I'm very pleased to be here this morning to at least frame for you the importance of protecting mothers and children, especially in low and middle income countries. But I think that's important across the world. You have heard our colleague Jennifer Epifanio and her very moving statement of her own death of a son, and you have heard the minister in Germany, Dorothee Bär, speak movingly about the issue of being a mother and what it would mean to lose a child. So with this in mind, how do we move these forward? Okay. I need to move the slides forward. Yep. I'd like to talk a little about the importance of protecting mothers. And this is a slide, this is some data from Save the Children a few years ago, where the report stated that at least 20% of the burden of disease in children below the age of 5 is related to poor maternal health and nutrition, as well as the quality of care at delivery and during the newborn period. And the importance of this mother-child bond is really stressed by the fact that children left motherless are 10 times more likely to die within 2 years of their mother's death. In fact, the mother's health represents children's best hope for survival. When a mother dies or is weakened by a disability or is overwhelmed by the needs of many children, her children's lives are threatened and too often lost. Conversely, if a mother's health and well-being are supported in tandem with child survival efforts, then mothers, children, and all of society benefit. Apart from death, children without mothers are less likely to receive proper nutrition, health care, and education, and hence their potential, long-term potential is stultified. Now, the importance of this bond is illustrated by the next 2 slides, where we know that of the newborns, neonates that die, 1/3 die in the first 24 hours. And when we look at the 6 common danger signs of the WHO, the IMCI, we found there's a study that found that in several African countries, knowledge of the danger signs was very low. Only at least one danger sign, 60% of mothers recognize it, and at least 2 was only 15%. And one of the solutions proposed, in fact, a decade ago, was education of mothers and promotion of birth preparedness to ensure survival of their children. This is a study just about 3 years ago that showed that what has been considered the formal education as a social vaccine. Indeed, if mothers completed 8 years of education, that's sort of high school, children had under 5 children had a 31% less chance of dying, and with fathers was less, with 17% less chance. And the graph at the top, a graph from UNICEF, shows that the longer that young women are kept in school, implying better education, better preparedness, job prospects, one can see with various countries, the neonatal mortality decreases. And hence, it's important to support young women in schools. We are at a very important juncture. When we look at maternal deaths per 100,000 live births, one can see we have been making gains since 1990. But at around 2016, this has plateaued. Previously, there was a 3% annualized rate of decline, but we have a plateau now, and very little gains have been made for almost a decade. And hence, if we are to meet the sustainable developmental goals, there's a lot more that need to be done. Similarly, with the deaths of newborns, one can see we've made steady gains again, 2% annualized rate of decline since 2000. But this isn't fast enough. And if we look at the goal of 12, less than 12 per 1,000 live births, one can see we are far from target and may not achieve the target by 2030. Hence, there's a lot more to be done. Again, these are maternal deaths per 1,000 live births. The darker areas in the world shows the highest mortality rates, and one can see much of it is in sub-Saharan Africa, in South Asia, and some in Latin America and the Caribbean. If we look at this graph, it shows similar sort of thing. Sub-Saharan Africa, the maternal mortality rate is still very high and have decreased slowly. And second would be the Eastern Asia, which is also, and Oceania, which is slowly again. Now, every day in 2023, over 700 women died from preventable causes related to pregnancy and childbirth, meaning that approximately one woman is dying every 2 minutes. So one can see during this conference how many women would have died if the present trend continues. And 90% of all maternal deaths occurred in low and middle income countries, and most could have been prevented. If we look at child mortality rates and numbers by age and under 5 child mortality rates, in this slide, the landmass of the countries are represented as a proportion of number of under 5 deaths. And one can see that Europe and North America, there are less deaths in South America, but again in Africa and Asia, one can see the high mortality rates of children, which corresponds to the areas in which there are also high mortality rates for mothers. Now, their maternal mortality or death occurs beyond biomedical causes, and it needs multi-sectoral action. We all need to be involved. There are the social determinants of health. I mentioned education already, ethnicity, gender, income, and race matters, and we need to address those. There are harmful gender norms and biases in inequalities across the world, and these permeate societies and stultify gain in maternal and newborn outcomes. Indeed, in countries where there are less biases, studies have shown that the outcomes for mothers and children are a lot better. The external factors causing instability, external shocks and disruptions, such as climate change, conflict, post-conflict and disaster situation, and pandemics also affect mothers and their children disproportionately. And at the present time, it's a major problem across the world. Weak health systems also, access to safe, quality, respectful, and affordable care, including maternal health services, are sorely needed worldwide. This slide shows us the under 5 and neonatal mortality by income group and fragile and conflict-affected situations worldwide. And in the fragile and conflicted areas, one can see the dark here. The under 5 mortality is very high as opposed to non-conflict areas, similar for the neonatal population. And also in low and middle income countries, one can see it's very high and low, and it decreases as the socio-demographic situation improves. Again, very same for neonates across the world. Now, infectious diseases are the most common cause of under 5 deaths across the world. Indeed, when we look at the issues, most of these issues, lower respiratory infection, pneumonia, malaria, HIV, AIDS, tetanus, diarrheal disease, meningitis, they constitute sepsis, and it's a number of most important diseases. And even with diseases that are non-communicable diseases, prematurity, birth asphyxia, etc., and in 1 to 59-month-old, other malaria, etc., and injuries, sepsis contributes to the final common pathway of death and disability. The effective solution for mothers and newborns This slide, we will not go into detail for the interest of time, but the yellow simple measures such as promotion of breastfeeding, immunizations, antenatal care, infection treatment, the ones in yellow, while delivered to the mother, also benefits the newborns. For instance, promotion of breastfeeding, etc., emergency obstetric care, counseling and vaccinations, whereas the care that directly addresses the newborn that are simple and inexpensive: kangaroo mother care, hand washing, clean cord care, newborn resuscitation, and simple measures emergency newborn care that can be afforded in most areas of the world. Now, so I would like to propose that taking care of mothers and newborn is not just an expenditure, it's an investment for us in the world. There's reduced poverty when we address this, reduced inequality, improved economic growth, increased social cohesion, and it is very important we address the issue of mother and newborn care, and under 5 also, to achieve the Sustainable Developmental Goals. Thank you very much.
Je peux procéder. Jag snackar med dig med.
There was a technical problem, as I understand. So thank you very much, Tex, for the excellent presentation, for reiterating that the cost-effective interventions across the continuum of perinatal and neonatal, pediatric and maternal care are essential not only for averting most of the preventable sepsis-related deaths and disability, but are extremely important for reducing poverty and inequalities, especially in the most affected countries and regions of the world. Now I have the immense pleasure and honor to invite our next speaker, Tore Laerdal, who is the Executive Director of the Laerdal Foundation, the foundation that specifically supports practically related research and programs for saving lives at birth in low-income countries. Laerdal Foundation is also the founding partner of the Acute Care Action Network, hosted by the World Health Organization. Tore has rich practical experience in both developing, industrializing, and distributing innovative products, and some of the examples are Helping Babies Breathe program, Survive and Thrive program, and the WHO Basic Emergency Course that has been supported for scale-up by the Laerdal Foundation through the WHO Academy. As mentioned, Laerdal Foundation has supported Global Sepsis Alliance, WHO, and Society of Critical Care Medicine in developing the first multi-year research strategy for sepsis, as well as the first global report on health system response to sepsis. We are especially grateful to Tore and Ingrid Laerdal for believing in the cause of sepsis, believing that sepsis as the leading cause of death should be much more visible and prioritized in global health architecture. Thank you, Tore, and please, over to you.
Thank you very much for those kind words, and I'm delighted to be part of this opening session and to talk about the urgency in investing in global sepsis response. So, as addressed already by several speakers, sepsis may be called the invisible cause of every fifth death. And the numbers mentioned in these bullet points are known to most of you, so I don't need to spend time on it. But it's a massive problem, and it's not very visible. So why so little investments in sepsis? Well, there is a lack of reliable data on sepsis as a separate cause for deaths. Instead, deaths are reported typically by their root causes, such as injuries, postpartum hemorrhage, HIV, and malaria. Sepsis is also a very broad term and not very well understood by politicians or the public, and therefore receives regrettably little attention. This is a illustration of how the various funding to the different areas of global health is allocated. And we don't need to go into all the other categories. The important thing and the scaring thing is that sepsis is not even mentioned among these categories. And again, it has to do with the comments I made to the previous slide. There is a Lancet Commission on investing in health. It's called 50 by 50. And it has the goal of setting the new goals beyond the Sustainable Development Goal post in 2030. So this is looking at 2050. And 50 by 50 indicates the goal of having a further 50% reduction of premature deaths, defined as deaths under 70 years of age, by 2050 by focusing on 15 priority conditions. And these are listed to the left. And again, sepsis is not even listed as a standalone priority. Yet it is the leading proximate cause of death across multiple priority conditions, particularly, as we heard Tex talk about, neonatal, maternal, and infectious diseases. So framing sepsis as a cross-cutting indicator of health system performance would reinforce the Commission's emphasis on first-level hospitals, emergency care, and quality of life. WHO is talking about 30 million deaths annually by time-critical medical emergencies. And 4 of them are of about equal size, claiming more or less 5 million deaths globally per year: cardiac arrest, stroke, trauma, and maternal newborn deaths. Now, the invisible one, sepsis, is much bigger: 13 million deaths per year by sepsis. And note how these circles almost indicate silos, because what is needed is a different approach, looking at healthcare systems and addressing the overlapping causes, because the circles to the left add up to 33 million deaths, but some of them are ending up dying from sepsis, where the root cause may be a postpartum hemorrhage or a massive bleeding or a malaria. So sepsis is not adequately reported and appreciated as a problem. And that is why, as Mariam mentioned, the WHO recently, in response to the so-called ECO resolution, formed the Acute Care Action Network. This is a new network or new initiative committed to saving millions of lives by strengthening acute care systems through collaboration. And among, by now, about 90 participants is both the Sepsis Alliance and the Laerdal Foundation. So what can we do to strengthen acute care systems through collaboration? As an example, funding of new concepts also in global health. typically go through 4 phases. You see the timeline on the x-axis, and that may stretch 15, 20 years. And you see the growing impact on the y-axis. So in the first 4 or 5 year periods, that typically is represented by pilot studies and early transition to scale in a small scale. There is relatively little impact because there is not a scaling. And you see on the second line from the top that the typical funders in these phases are developers and NGOs or foundations and aid organizations. The problem appears as we get into the later stages because private funding is seldomly available for more than 5 or maybe 7 years, but it may take 10 years and more until we get into to phase 3 here, innovation to scale. And this is where there is a need for bridging funding to take the further process from donorship to ownership. For instance, by involvement of the World Bank or the Global Financing Facility or by WHO. These are the organizations that are closer to the national ministries of health and the ministries of finance. This dialogue is extremely important because unless it can be proven that the new intervention is so cost effective that it deserves to ultimately be embedded in national healthcare budgets, then it's also very difficult to get it to sustainable value. So phase 3 here is the phase where private funding often ends and many programs fail. So there is a need to build an investment case. First in the phase 1 and 2 by establishing solid evidence, and then in the later phases by scaling the evidence-based programs. And we are delighted to team up with the Global Sepsis Alliance. And it's a collaboration that also comprises WHO and Society of Critical Care Medicine in the US on a 3-pronged program to establish global reports and dashboards for the extent of sepsis, to set a global sepsis research agenda through an Utstein meeting, which is actually taking place in about 2 weeks from now, and through the Society of Critical Care Medicine to start some implementation cases to apply this research agenda. And hopefully then the execution of these 3 points can bring the evidence that is necessary to build an investment case, or at least contribute to that, so that the scaling could take place later on. And I'm pleased to add that we have recently established a scale-up fund that aims at being a contributor by catalytic co-funding with other foundations to take these innovations to scale. And we will follow very closely the development of the program of the Global Sepsis Alliance, hoping that that can qualify for further funding from both us and others later on. So in summary, sepsis remain a hidden cause of every 5th death. No major funder currently treats sepsis response as an integrated end-to-end delivery problem. Instead, investments are fragmented across other root causes of death. So there is an urgent need for establishing and communicating an investment case and giving sepsis the due attention and funding it really deserves. Thank you very much.
Tori, thank you immensely for presenting the vision behind your strategy, how we can make the invisible leading killer of children and women more acknowledged and positioned higher, both in dialogue, political dialogue, and funding architecture for global health. Thank you for mentioning that the Lancet 50 by 50 historic publication has hardly mentioned sepsis, maybe once or twice, and also in relation to antimicrobial resistance. But let us hope that the ongoing work of the Lancet Commission on Sepsis can bring stronger evidence for constructing the critically needed investment case for sepsis that would really allow us to leverage partnerships and resource investments, primarily into member states, primarily into government-led initiatives, and of course, creating this essential public-private partnership platform. Needless to say that we all look forward to joining WHO, SCCM, and the Laerdal Foundation team at Achstein and to convening we hope, a game-changing consultation on the sepsis research strategy that hopefully will help us to scale up the both implementation, awareness raising, and political and financial investments in sepsis. So thank you once again to you personally, to Ingrid and the Laerdal Foundation for this extremely important support. Before moving to the next speaker, I would like to highlight that as of now, the opening session is viewed by more than 30 country delegations, and I would like to acknowledge your greetings and supporting messages from Tunisia, Sudan, Mexico, Serbia, Colombia, Pakistan, Gambia, Argentina, Poland, Zambia, United States represented by Massachusetts, California, Portland, and New York City. And we shall list the other country delegations after the presentation from our next speaker. And it's my absolute delight to invite now to the scene Dr. Amany Asfour, my dear friend and colleague, president of the Medical Women's International Association, who has been a distinguished physician, business leader, and international advocate for women's empowerment and women's health across Africa and beyond for more than 30 years. Coming from Egypt, Amany has been the president of the International Federation of Business and Professional Women, president of the Egyptian Businesswomen Association, chair of FEMNET, and founder of the African Pediatric Nephrology Association. She's the board member of African CDC and serves as a member of the African Union Foundation. Amany, thank you very much for joining us, and thank you especially for continuing the strategic partnership between the Medical Women's International Association, the Global Sepsis Alliance, that was started by under the leadership of Dr. Eleonore Nwadinobi, our dear colleague and sister from Nigeria, as the immediate past president. But your reaffirmation and your extremely strong support to the sepsis agenda really gives us the hope that we will once again scale up the awareness and the needed support from the healthcare providers and policy leaders. Please, Amany.
So thank you very much, my dear Dr. Jashi and dear Professor Kissoon, dear Professor Reinhart. It really gives me a great pleasure today to join you in this very important Sixth World Sepsis Congress, which is truly a global platform dedicated for universal sepsis care for newborn children and women. And on behalf of the Medical Women International Association, I really extend my sincere appreciation to the Global Sepsis Alliance for convening this remarkable gathering of experts, advocates, policymakers from across the whole world. I believe the scale and inclusivity of this Congress, bringing together thousands of participants from many countries across the world, really reflects the magnitude and the challenge before us, but also the strength for our collective commitment to address it. As the oldest organization, International Association of Medical Women in the world, since established since 1919, with a legacy of spanning more than 106 years, the Medical Women International Association actually remains fast in its mission to advance health, well-being, and rights of women while empowering medical women professionals across the world. Today, I'm proud to represent over 12,000 medical women across 45 national associations in more than 70 countries. So our strategic partnership with the Global Sepsis Alliance, established since 2024, marks a significant milestone in strengthening global advocacy and accelerating our agenda and action. And I believe together we have worked to elevate the sepsis on the global health agenda through policy engagement, knowledge exchange, awareness initiatives focused on prevention, early detection, quality care. And I believe in this context that I'm pleased to highlight that the Medical Women International Association, in collaboration of the Global Sepsis Alliance, have already successfully convened 3 side events on the sepsis alongside the UN General Assembly between 2023 and 2025, as well as the first official side event at the World Health Assembly last year. I believe those milestones reflect our shared commitment to transforming global dialogue into real, tangible action. And I believe that looking ahead also, we are honored to once again host, like my dear sister, Dr. Jashi have mentioned, a joint official side event on May 21st at the 79th World Health Assembly in Geneva, focusing on protecting 26 million women and 20 million children affected by sepsis each year. I really warmly invite all the stakeholders here to join us in this very important and critical effort. And I believe the burden of sepsis remains really staggering. It is associated with 1 in 5 deaths worldwide, disproportionately affecting the most vulnerable, newborns, children, women, of course, particularly in low resource settings. And I believe, as highlighted across the program, from maternal sepsis and neonatal care to health system strengthening, technological innovation, it's clear that addressing sepsis actually required a comprehensive system-based approach. So as Medical Women International Association, we are deeply committed to advancing awareness at the community level, strengthening the capacity of the frontline healthcare professionals, early recognition, timely intervention, and equitable access to care must really become our universal standards. Again, it is also very important to highlight that we reaffirm the support of, as I am also the co-chair of the Health Committee of the National Council of Women of Egypt, we also like to reaffirm the strong support of National Council of Women, and also Egypt, under the leadership of His Excellency President of Egypt, has put great policies and done great effort for promoting women health. And also I'm glad to confirm our support to fostering collaboration with the Global Sepsis Alliance, the World Health Organization, and key partners. I believe together we can reduce the burden of sepsis at regional, and global levels. So I think that it is very important to really join efforts. And as the Medical Women International President, I have already adopted a theme for our triennium, which is about advancing women's health and promoting women's empowerment to achieve the Sustainable Development Goals. Because I believe that we are not able to really realize the Sustainable Development Goals unless we really achieve a health-related Sustainable Development Goals without addressing sepsis, particularly among newborn children and women. So I really believe that it has to be a multifaceted approach. And I call it the triad of empowerment regarding 3 pillars. The first pillar is professional healthcare capacity building by awareness, by strengthening our healthcare professionals and the front lines with early detection, with quality control. The second pillar actually is about policy advocacy. We need to work on the policies, how to really allocate budget for healthcare infrastructure and put sepsis on the highest agenda of this budget. Again, with the policies, we need the governments to put some laws in order to see how we are really promoting early detection, and to see how these policies would really prevent this and with the quality care of all the hospitals. The third pillar actually is about partnership. And I think the previous speakers have really alluded to how partners and partnership could really support in this agenda, whether it is from the private sector, how we allocate funds for the sepsis, NGOs to raise awareness among this very important issue, and of course, again, with the gender machineries across the whole world. I mean, and we have to have best practice. Like, for instance, if I come from National Council of Women of Egypt, we have what we call the rural social workers, who are, we call it the campaign of knocking the doors to going to all the villages, the rural areas, to give awareness and health messages to the whole family, to the women who are pregnant, who have already delivered, to see how we are able to perform these health messages. Again, for funding, it's of crucial importance to have partnerships with private sector, with philanthropists, with really to have established projects that is really geared towards this agenda. I'm so happy to be here in this very important gathering, and we are looking forward with our collaboration with the Global Sepsis Alliance to our future events, and also to have a strong partnership, and to look forward to see how we reduce this big burden of sepsis across the world. Thank you, my dear sister, Dr. Mariam, and happy to join you today.
Amany, the pleasure and honor is all ours to be to really join the hands and efforts in the sepsis fight. And again, I would like to extend special thanks to Medical Women's International Association, my dear colleagues, and our joint leadership for giving us the opportunity to really speak about sepsis at the World Health Assemblies, at the ECOSOC meetings, at the UN General Assembly side events. And we really look forward to another successful event at the World Health Assembly on May 21, and hopefully as an official side event on sepsis also at the United Nations General Assembly in September. And let me quote you, like, let's really make sure that we knock on every doors, not only in families, but the decision makers, the innovators, researchers, and the financial institutions, for making sure that sepsis becomes the term that is that brings the urgency of the matter to the communities and stakeholders. Thank you very much, dear Amany. Before moving to our concluding presentation, I would like to acknowledge our participants and delegates from Egypt, Amany's country, Brazil, Spain, my dear Georgia, Ghana, Turkey, Nigeria, Belize, Germany, Saudi Arabia, Rwanda, South Africa, Angola, Tanzania, Greece, Malaysia, Ethiopia, and Australia, including a sepsis survivor from Western Australia. And again, going back to our opening speech by Jennifer, many of those messages, many of the greetings, Jennifer, are addressed to you and your dear family. So we have already been reaching more than 30 countries today by Elias' story, and again, trying to make sure that Elias story protects many others. So thank you again, Jennifer, to you and Daniel for all you have been doing. Finally, we have the keynote presentation from Professor Konrad Reinhart. We would not be here today, none of us, without Konrad. And I think he's the most well-known name in the global sepsis response, the founding president of the Global Sepsis Alliance, the president of the Sepsis Stiftung, the German association foundation for sepsis, and the member of the Academy of Science Leopoldina in Germany. Konrad, thank you very much for all you have done for the Global Sepsis Alliance, for your leadership in establishing the World Sepsis Day movement, and you as the founder of the World Sepsis Congress that as of today has already reached more than 120,000 healthcare providers, researchers, and innovators completely free of charge to make sure that the latest cutting-edge knowledge is available to all our colleagues, to all our supporters and sepsis advocates, families, patients, everywhere. So that is the special strength of the completely online World Sepsis Congresses that reaches everyone everywhere. Konrad, over to you.
Thank you, Mariam, for your very kind words, and I feel honored and moved. But I think we need to do more what we have heard today. And I have to speak about closing the gap in universal access to sepsis care. But it's not just about access. It's also about a better understanding, as it was mentioned by many of our esteemed previous speakers. Sorry that this does not move right now, but so. And the burden is still or even higher than we have thought. And this publication was already mentioned, which was published by our esteemed colleagues and friends from the University of Seattle and the authors of the Global Burden of Disease reports, who jointly work together also with Oxford University. And what they provided is really unique and a major step forward, because they analyzed the development of sepsis-related cases and deaths from 1919 up to 2021. And they came up, and this is published in the Lancet Global Health, and also available on the excellent website, where you can, on your own, look up how the burden of sepsis is for all cases, causes of sepsis, and different age groups. Based on this report, we have to look and think, and the estimates are 21.3 million sepsis-related deaths and 160 million sepsis cases. About 7.7 million are attributable to bacterial infections, and as 2021 was still the high wave of COVID-19, low respiratory tract infections, including and mostly by COVID, are responsible or attributable, make 11.3 million deaths. And interestingly, as already mentioned by Dr. Laerdal, that non-communicable diseases are related and a complication of sepsis in 5.8 million deaths. This offers a unique necessity and opportunity to collaborate in the future very closely with those advocates and organizations who take care of these patients. Interestingly, also the number of resistant antimicrobial resistance deaths are over 1.1 million, and around 4 million are associated to sepsis. If you look at this, the quote that was done by Sir William Osler around 1900, that humanity has but 3 great enemies, fever and famine and war. Of these, the greatest, by far the most terrible, is fever, holds true still today if you compare at these major health threats. But it's not yet adequately understood. And most interestingly and encouraging by some way is that we have achieved an enormous reduction of infection-related deaths, which by definition now are attributable to sepsis, only interrupted by the so-called Spanish flu in 1919. And how did this happen? It happened by local, and this is data from the US, public health measures like improvement in sanitation, like chlorination of water, like development of vaccines, like developing of antimicrobials, and in some way prioritizing the fight against infectious diseases, which historically was always during the development of mankind by pandemics, but also outside of pandemics, the most preventable or greatest threat. And if you look at the number that in 1980, this mortality rate went down from 800 to 36 per 100,000 population. And the success factors were those that I have already mentioned. And it's a tragedy that this success story probably is the most important case why we lost track and underestimated the burden of sepsis. Still, during World War II, this poster was sent out on behalf of the Ministry of Labor and National Services in the United Kingdom to their population and also to the soldiers, which warns to neglect oneself and which encourages the people to look for the first signs of sepsis because it uses blitz methods. And they argue rightly to neglect yourself will help Hitler because, and this was probably true, the deaths from sepsis or blood poisoning was higher, as they mention in this poster, than the deaths which were attributable to the German Allied forces. But as I mentioned, this success story went along with the notion that the book of infectious diseases might be closed because we have been so successful. And these are shocking numbers, again, derived from these publications of our colleagues from the Global Burden of Disease reports, which came out late in 2025. And this data suggests that in the US, in 2021, more than 260 deaths per 100 population were attributable to sepsis. In Germany, the number was similarly high. And this means we have an increase by 7 to 8 times, even in these high-income countries, due to sepsis. And this is unbelievable. And I mentioned all this is disclosed. And it's even worse, if you look on this map, also which you find in this publication, but also on this website, which tells us that globally, and we were pretty sure when we published the first papers on the global and estimates on the global number of sepsis-related deaths, that it will be much higher as what we thought when the WHO sepsis solution was adopted in 2017. We thought it would be at least 5 point somewhat million deaths. But if you look at this map, you see that there is a range between 10 to 70% of the total deaths in the various countries which are related to sepsis. And it's very astonishing just to hear again that still global funding is mostly or attributed and provided for the underlying infections and not to the sepsis. The great thing about this new website and this publication is that, as I mentioned already, you can rank the countries. And you see that even among comparable countries, which are not at all different in terms of resources and access to resources, in terms of ICU beds, etc., etc. Again, these are the estimates for Germany and on the top, Switzerland, Sweden, UK, and also Australia. And how come that there's such a huge difference? And this was in the media, in the prime media on World Sepsis Day last year. And still, there could be more understanding. And this is the moment really to thank the colleagues around Chris Murray and Mohsen Nachavi, who were willing to work with the Global Sepsis Alliance and with some of our colleagues from Pittsburgh and our colleague and Tex Kissoon to really put more focus on sepsis, because in one of the first Global Burden of Disease reports in 2012, we realized that sepsis was mentioned only in the context of neonatal sepsis, mentioning at the same time that lower respiratory tract infections is the #1 cause of quality of life years lost. So as was pointed out by Dorothee Laerdal, that this is the reason why the burden of sepsis is poorly understood until today. And this is also the reason that 50 years ago, when I started as a young physician on an ICU, I had heard nothing about sepsis in the medical school. There were no guidelines, no educational efforts, and no awareness and advocacy, no funding for research. And even 10 years ago, sepsis was not a priority by WHO. There was no information on sepsis on the website of the CDC. Sepsis, as mentioned, not in the Global Burden of Disease report. And only Then when we come rightly up around 2001, 2002, with the Surviving Sepsis Campaign guidelines, at this time they were only primarily focused on high-income countries, and there were very few in the national sepsis initiatives at these times. And that's why we also have been very grateful to those who have helped to bring this topic, this neglected topic, on the global agenda. And I have to thank, and we have to thank the former Minister of Health, Hermann Gröhe, Helge Braun, later Chancellor Minister, and especially also Margret Schan and also Achim Steiner, who was so kind to understand and to get also involved in this dialogue that sepsis came on the agenda of the World Health Assembly. And we had hoped at this time that this would initiate really a fast spread, that sepsis is recognized as a health priority. Also, because not only Sir Liam Donaldson, but because others before has mentioned that the public and political space is a space in which sepsis needs to be in order for things to change. And this was realized very soon by also the cancer community, who rightly asked for a moonshot against cancer, who had big ads in the newspapers, Washington Post, saying, Mr. Nixon, you can cure cancer, etc., etc. And the core message of this resolution was that it urges member states to include prevention, diagnosis, and treatment of sepsis in the national health system, strengthening in the community and in healthcare setting. It also mentions that 80% of sepsis cases occur in the community. So that's why it's so important. And if you look again on this website, what I did on this occasion, you see how enormously the difference is where you live, so that there is this inequity with 28,000 deaths in neonatal deaths, for example, in Central Africa, which compares to only 300 deaths of sepsis in Germany, which compares to 479 deaths in Switzerland, but to much lower deaths even in Norway with 248. So this tells you that we have a long way to go to overcome these disparities. And the same data hold true for the under 5-year-olds, the death per 100,000 population. In Central Africa, 1,689 are the estimates, which compares to only 12 in Germany. In the United States, it's 22 deaths per 100,000 population in this age group. And in Finland, it's even lower with 8.6 deaths. So this tells you, yes, sepsis is preventable, and whether it occurs or not is a question of priority and also of the quality of the healthcare systems. And we are so grateful that the German Ministry of Health has funded in a program which exists already around 8 years, which is about capacity building and bringing together in sub-Saharan Africa. And it's great to see that this was possible due to the efforts from two German university. One of this is Charité and one the University of Düsseldorf, but also because there was an African Sepsis Alliance, and we started to establish the regional sepsis alliances since 2018. And given on this network that we had established, we were successful and got funded for 5 years with 11 million. And it's great to see the enthusiasm and which exists and the willingness to change and to learn, and also the willingness of the leadership on the government level and also on the level of the African Union. And what we could also learn is that those countries who have been successful in the fight against sepsis with this low number of deaths from non-pandemic causes, they had less also excess deaths during the pandemic. In Australia and New Zealand and Norway, there was no change at all, or even some reduced less deaths compared to the non-pandemic period. Luckily, and Finland has been performing well, Norway has been performing well, Denmark, and it's my pleasure to see that also Germany, which really is ranking very poorly in the non-pandemic related sepsis, number of sepsis deaths and causes, has done quite well. And this underpins the fact that if you need to fight in sepsis effectively, it requires a cohesive societal approach, which involvement of the leaderships on the political level and the leadership of the responsible people in the healthcare system. And that's why I think we must continue and to overcome the poor knowledge that we have so far and not give up. And that's why we are looking forward also to this Utstein conference, which kindly was made possible by Ingrid and Tore Laerdal from the Laerdal Foundation. And it's badly needed because, as it has been mentioned before, otherwise we will not reach the Sustainable Development Goals. And this is one thing. And the other thing is that given the aging populations in many parts of the world will increase the burden of sepsis, and also the climate change will increase the burden of sepsis because the vector-driven diseases like dengue and many others, as we had to learn now, will spread even more so. So let us not give up, although we are still somewhat disappointed on the low awareness also by our esteemed colleagues in research and who are setting the stage. But we have made so much progress over the last 20 years. And I thank all of you and the leadership of Tex and Mariam and the leaders of the Regional Sepsis Alliance, but even more also now that also by WHO and also hopefully also by the United Nations, that there's an increasing understanding that it can be done, and not only by the measures we have discussed already. One lesson which I have not addressed is that COVID-19 has showed us that our attempts to find sepsis-specific measures by interacting with the immune system was which were not successful in the last 20 years. We have seen during COVID-19 that this concept is still valid and effective and has resulted not only in emergency use authorizations during the pandemic, but in the meanwhile also now to approval of compounds which interact not only with cytokines but also with the innate immune system. So thank you so much for your attention, and I look forward to work with you in the future. And I'm so glad that there are so many people taking over in many countries and understand that it is badly needed. Thank you.
Thank you very much, Konrad, for your always inspiring, insightful, critical, but encouraging presentations to move forward and to continue our fight until it's done indeed. As the second session of the World Sepsis Congress has just started on maternal sepsis, early recognition and management, moderated by our dear esteemed colleague Mercedes Bonnet from WHO, of course, I will try to keep the summary part of the session as brief as possible. Let me first acknowledge the additional country members who have joined us through the chat from Oman, India, Malta, Abu Dhabi, United Arab Emirates, Puerto Rico, Netherlands, United Kingdom, and Italy. And let me hereby acknowledge some of the supporting messages. Most of the response from our audience was supportive, acknowledging the work of the Global Sepsis Alliance. We're very grateful for your feedback, but also highlighting three important messages. First, that there was an encouraging message on the progress in sepsis diagnostics, rapid detection and pathogen identification through the biomarker and other new solutions. We had a readiness message from our colleagues from low resource settings that they would be happy to participate in the 10 by 10 implementation research project supported by the Laerdal Foundation. And finally, we had a reaffirming message that indeed the global burden of diseases is completely missing the burden of sepsis that is taking 1 in 5 lives worldwide. In the conclusion, let me acknowledge our supporters and founders of the World Sepsis Congress. I would like to extend special thanks again to the Gates Foundation to be one of the major supporters of the 6th World Sepsis Congress, focusing on universal sepsis care for newborns, children, and women, and our silver sponsors, bioMérieux, Menarini, and Sobi. We also thank more than 20 regional, global, and national associations who have been the official supporters of the Congress, and the list of the organizations is available on the official site of our event. Last but not least, I'm delighted to announce the theme and the dates of our next Congress, the 7th World Sepsis Congress, that will focus on reimagining sepsis care, innovations, implementation, and global equity, will be convened on April 2021, 2027. And I would like to acknowledge the work of Dr. Imran Malik, the board member of the Global Sepsis Alliance, who together with Tex Kissoon and myself and other members of the scientific committee and the Global Sepsis Alliance board have consolidated the discussions and identified the theme of our next Congress. Again, reimagining sepsis care, innovations, implementation, and global equity. I take this opportunity to thank our esteemed panel today, the brilliant speakers for your extremely important contributions, and for our ongoing collaboration for making sure that we save lives from sepsis and we jointly implement realistic and visionary global agenda for sepsis for 2030. Thank you, and we hope that the audience will join the next session on maternal sepsis, as well as other 13 scientific sessions that the current World Sepsis Congress offers to you. Thank you.